news tonight about medical-grade masks. President Trump had ordered the company 3M to stop importing masks it makes in overseas factories. He wanted them all made in America and to stop shipping any to Canada. Canada pushed back, and tonight the company says it will import 166 million respirators over the next 3 months to support healthcare workers in the U.S. And that plan will also enable 3M to continue sending U.S.-produced respirators to Canada and Latin America, where 3M is the primary source of supply. There is another fight brewing with the U.S. after reports hundreds of thousands of medical-grade masks bound for Ontario were held up at the U.S. border.
That, of course, is a two-way street. Both countries benefit from this, and both countries would lose out if hurdles were to be put in the way of that flow of healthcare support between our two countries.
And there is new advice today about wearing homemade masks in public, even if you have no symptoms. Public health officers in Canada now say they may provide some protection from infecting others, but they are no substitute for physical distancing. Mike Drolet on the developing story around masks.
Okay, and then we just want to pull it up.
There is no more sought-after item in the medical supply world right now. When a shipment of American-made N95 masks bound for Ontario was stopped at the border on the weekend, it set off a political tug-of-war.
Getting it across the border right now is very difficult. Right now, I understand there's 2 separate orders of close to 4 million masks. 500,000 have been released.
The fight over masks hit its crescendo last Friday when U.S. President Donald Trump invoked the Defense Production Act, preventing 3M from exporting them to Canada and Latin America.
We're very disappointed in 3M. They should be taking care of our country.
On Monday, Ontario's premier was blunt. Frontline workers are running out.
We're down to about a week's supply.
And it's not much better in Quebec,
Les équipements, on a actuellement 14 jours.
Where they're down to under 2 weeks' supply. 3M says it is able to manufacture about 100 million N95 masks per month, which would be a remarkable number except for the unprecedented global demand. Deputy Prime Minister Chrystia Freeland called the marketplace for masks the Wild West. France and Brazil are among countries complaining about being dramatically outbid on orders. All of which has led to Canada's chief public health officer to instruct hospitals to hold on to used masks that could be disinfected, and now telling the public homemade masks are better than no mask at all.
Wearing a non-medical mask is an additional measure that we're considering to protect others around you.
With so little inventory, she says all the medical-grade masks are needed for frontline workers. Mike Drolet, Global News, Toronto.
We will continue to consult with experts and try to answer your questions. You can send them to yourquestions@globalnews.ca. And on our website, you'll find a special page dedicated entirely to COVID-19. That's at globalnews.ca/coronavirus.